The other council member on this committee is
537.
Emily Pfaff,
Thank you, Bonnie.
Dr. Stockwell's daughter.
So I'll call to order the Common Council Community Wellness Committee, Tuesday, April 12th, 5:30, and I guess it's actually 5:35. So roll call, I'm here, Luke Murphy. Here. And Emily Falco is on vacation this evening. So tonight we have with us Dr. Reggie Knight. Doctor, I guess I'd like to just kind of introduce what we're doing in this committee, our task, and then I think we'd really like to hear from you. So Mayor Drenick tasked this committee, the three of us, Dr. Georgeson as our health officer and our chiefs of police and fire, with beginning to kind of examine and obviously trying to, as best as we can, improve some of the kind of primary issues in the city that are impact community wellness. And so our kind of short list is homelessness, mental health, addiction, food insecurity, COVID, and then issues that might arise that are linked to community wellness. There's a lot there. There's a lot of different issues going on there. We've been, I'll speak for myself, I've been spending a lot of time here trying to get up to speed on a lot of these issues in terms of how they're impacting people within our community. We've had a lot of great information coming from our chiefs who are kind of on the front lines of encountering this every day. We decided that to be able to begin kind of attacking these problems, first we wanted to understand as best as possible the scope of these problems. So we're putting together an advisory group made up of different experts from the area who will be able to advise us from time to time. We've already kind of tapped into those folks, and Luke has put together a survey to try to understand some of what some of these challenges are, what some of the needs are, what are some of the holes that we might have in service. This is Mayor Drenick.
Yeah, my apologies. I was at a funeral home and longer than I anticipated.
This is Dr. Knight. So we're just really trying to understand the scope of the problem here, areas that we have strengths in, areas that we have weakness in, to try to do kind of a community, an assessment of our community's ability to support, an assessment of our community's ability to be able to address these different issues. So we're also simultaneously looking at how other municipalities have addressed some of these particular issues. What are different kind of things that cities have done, and that's kind of where we're at right now. So what we're trying to do is then bring experts in and learn from it. You know, you have expertise in particular areas. I've already said I'm a former professor of education, now a dean. This is not my area of expertise, so we're really looking to learn from you all. Your name came to us. Dr. Georgeson was kind enough to she's been helping out, filling in a lot of the information that we don't have, and mentioned that you were kind of involved in the new program. And thought there might be a great kind of opportunity to kind of hear from you and hear what we're doing, and maybe look for places that we might be able to work together. Again, what role can we as a city play in supporting this? Again, we're still trying to get our arms around some of these different issues and figure out how we're going to be able to support positive action. So I think that kind of gives you a little bit of understanding. Luke, Doctor, if you'd like to fill in, please do.
Yes, and I would just like to say, in addition to the, I always forget the name, the initiative through the Bassett Research Institute, also you as the Fox Hospital person, that being sort of the cornerstone of health care in the community. I don't think we expect you to do more, but I think working with and maybe coming up with some partnerships. Our first responders interface with the hospital quite a bit, and I think they may see some needs, and especially I would say the emergency department may also be able to be of help in identifying some of the needs. You can see we're still at that identifying the needs phase of a community assessment. But hopefully with the resources of the city, we can partner, if needed, with the hospital and look at wellness in a comprehensive way. I would say in addition to some of these other social determinants of health like homelessness, food security, I think simple access to medical care and access to dental care, mental health care are important components of community wellness. So that's where I think the hospital system may play in a little bit more closely.
So I think that, I haven't heard anything that I can disagree with. I've been in my new role as the Chief Hospital Executive for A.O. Fox Hospital for all of 2 weeks. The first week I actually took vacation and went to see my grandson for his birthday. So I am somewhat familiar with the community because of my previous role as the Vice President of Medical Affairs at Fox. I was in that role for about 3 or 4 years before becoming Senior Vice President for the network. The things you described as the social determinants of health are things that we also recognize and are definitely looking for partners in the community. And in my new role, I was happy to join this group because it was one of my boxes to check to meet the new mayor and to figure out what we could do together. I know that previously we've had some conversations with the fire department about stationing or working to put a rig at the hospital to help us transport, which would be a major benefit to the hospital system and to our community. I'm not sure exactly where those conversations stand now, but would like to reinvigorate those if they've fallen on deaf ears in the last couple of weeks. You haven't heard anything about it, huh?
No, they haven't fallen on deaf ears. We actually just met about it today, so
Fantastic.
we're definitely working on it and doing our due diligence.
Sure enough. So that's part of the problem. When you have a restructuring, there's a lot of conversations that went on before, and there's lots of things that have been partially established, and the new people sometimes are playing catch-up. That's my role right now, so I'll have to get caught up on that. When I was here as Vice President of Medical Affairs, I was fortunate enough to work with a lot of the city charitable organizations in establishing a coalition for homelessness and the Code Blue. And actually, we met this afternoon. And so, again, timing is everything. So homelessness is a big problem, not only for residents of the city of Oneonta, but the Otsego County and surrounding counties. And the most difficult homeless community members we have are those that have other mental health or drug dependency issues that make them poor candidates for some of the other governmental agencies. So we're trying to fill that void. But we were very self-centered in trying to start that at first because some of these patients were ending up in our lobbies of our hospital and having to call the fire department or the police department to bring them somewhere else to get them away from the hospital. So that has worked out very well. Mental health is probably one of the largest issues that we have in our area. We're not unique in that. Bassett understands that. We are probably sending at least 1 or 2 patients per night away from our emergency departments for assessments for mental health issues, either down to Binghamton or up to St. Peter's or wherever to get them the appropriate care. So we are now looking at granting to get funds to consider reusing the 3rd floor of the hospital for some sort of mental health facility. So you might hear word of that coming through some of the political channels going forward. If you can use your support in that in any way, that would be very helpful. We are definitely trying our best to help with food security. The pandemic really threw a wrench into everybody's workflows. We had a very strong and vibrant food pantry down at Tri-Town, which is part of the Fox system. We're hoping to open that up and reestablish it, but unfortunately, COVID seems to be raising its head again. The Omicron BA.2 is quite contagious, but fortunately thus far fairly low in virulence. So if you're boosted and vaccinated, you're probably going to be fine. But the State Department of Health have kept us with masks in the hospital for sure, and probably going forward, small gatherings are going to be asked to put masks on again. I think that compliance with that's going to be important. But that's going to be one of the holdups for us opening a lot of things in the future. But you're preaching to the choir as far as our willingness to collaborate. I think that I'm telling everybody that I've met that my door is definitely open, and we welcome conversations, ideas, and proposals to work together.
If I can jump in just quickly, Dr. Knight, so thank you very much for joining this group today. Again, my apologies for my late entrance. The word collaboration just jumped out at me in your last sentences. I think if we can find our way to collaboration with not just you and Fox and the Bassett Healthcare System, but with all of those resources that over your time that you've been able to accrue as part of your various working relationships, it's going to this invention of this community wellness committee has been it's a big ask. It's a big thing to try to take on. It's a lot to put your arms around, and our expectation is that we're going to make small incremental progress in many different areas, and if we do, it'll have a transformative effect on any number of lives. We don't think we're going to solve all of these problems here, but we know that we need to tackle them. And by bringing to the table people who are not just willing to collaborate, but willing to take a leadership role in that collaboration is going to be, I think, key to our success. And I think that this committee would probably agree with that. So thank you again for being here.
So prior to the restructuring within the Bassett Healthcare Network system, population health would report up to me. And so another person you might put on your list would be Lynn Lindenmuth, who is our population health director. We are definitely looking at Bassett trying to become what they call an anchor organization within communities to help not necessarily provide all the services, but be kind of the linchpin between other like-minded organizations to try and increase the population wellness, so that we're not always dealing with illness. So there's lots more to come about that. We actually have to perform a community needs assessment on a regular basis, and we're in the process of trying to pull that together now. So I might be reaching back out to you guys to try and see, what your ideas are on how we might dovetail that with the Department of Health and Dr. Jorgensen. But I think there's a lot of momentum right now around these issues, and COVID, for better or for worse, has kind of brought a lot of the social determinants of health to the forefront. And in our community, one of our issues is health literacy. A lot of our patients do not understand what it is to be in a wellness program versus an illness program. And our school-based health programs have been something that we have really developed and gathered a lot of information about youth health literacy. So we are talking to a lot of other organizations, and you'll hear some of this coming down over the course of the next few months with our critical access hospitals. So Fox is a community hospital. It doesn't meet the critical access criteria, but O'Connor, Delhi, Cobleskill, Regional Hospital, and Little Falls are three hospitals within our system that are critical access hospitals. So there are other federally qualified health systems or health clinics that get a different reimbursement structure from the federal government that we're talking to try and see if we can't, again, collaborate. Because none of us can do this on our own. And if we can bring like-minded organizations and city governments together, state and federal government together to think about this in a broader sense, we have a better chance of at least chipping away at it. We're not going to solve it in our lifetimes, but we should be able to make things better.
Yeah, thanks, Dr. Knight. That affirms for me one of the things that we're thinking about. If I could just present you with what we're looking at, I'd really love to have your feedback. We're seeing the role of this committee as kind of three things. Is one, to facilitate conversations, to facilitate get groups together in the room. To that end, we're planning a summit. We're tentatively have it scheduled for the first week of August, where we would be able to get all the players, or as many of the players as we can, in the room together to start having some conversations. Dr. George suggested a kind of path forward on that. We're going to be utilizing our needs survey and targeting, looking at what that produces, and then having some particular groups on that moving forward. We also feel as though there's some untapped kind of strength within the municipal government from the standpoint. We have a wonderful, fantastic grants writer here on the city staff that we might be able to work with organizations or work with our fire chiefs or police chiefs on some different programs that could be grant funded that could meet some different needs. So we're hoping to be able to kind of identify some of those needs and maybe pursue some grants. And then lastly, Mayor Drenick has access to local, regional, and state meetings and other folks. He is someone who can kind of advocate for our community and get that word out there as well. So we're looking to use kind of one, facilitation, two, kind of what can we do to be able to meet those needs, and then three, the role of advocacy. And I'm not pointing all at Mayor Drenick, but certainly in his role that he is the biggest conduit for that particular advocacy. So that's what we've been kind of looking at as things that we can accomplish. In your estimation, I'm sorry to speak on the spot, is there anything glaringly obvious that we're missing that you feel that we could, in this role of a community wellness committee, could begin to address that we haven't kind of thought of?
No, I think that you've thought of the key issues. I have not been in this role long enough to say that there's a glaring absence of anything, but the key boxes you've checked. I like the idea of facilitating conversation, the grant funding, because we're going to have to get funding from somewhere. That's going to be very important. And it's very time consuming, as you know, to write a grant. And then the whole idea of advocacy, I think, is important. I was just appointed to the Governor's Council for Rural Healthcare, so I don't know what that means. Senator Oberacker nominated me, so I volunteered and said yes, but my wife is saying how many things are you going to say yes to, because, Nancy Reagan, but so I think that if we could have more people advocating for us as a rural community, that's helpful. One of the challenges that we have in healthcare is that the person who comes here to provide care is unique in that they value this type of lifestyle and they value these challenges. But then again, as a system, we're challenged to recruit them and retain them. So the politics around reimbursement for healthcare. Everybody wants something, but very few people want to pay for it. And so we have to figure that out. So I think that, Mark, this committee has hit off to a great start. And like most things, we have to just maintain that energy and keep it going with an agenda. The summit in August, I think is a great idea. Unfortunately, that first week of August, I'm already committed, so I can get somebody from my staff, hopefully, to participate. Mr. Lindenmuth would be probably the first person up on the list to think about. So if we have a date and time, I'll make sure we get somebody here to.
Great, we'll work to kind of
collaborate
get,
that.
my apologies, we'll work to get that solidified and get that date over to you. So we're still trying to kind of figure out what that best time would be. So.
Okay.
Okay, thank you. So I want to respond to one of the things that you said. My apologies, Luke, I don't know if you had anything you wanted to add?
No, I'm doing my best just to soak everything in. One thing that's really helped me at least begin to get a grasp at the more academic and more statistical level was in 2021, I believe it was Bassett, the network did a community needs survey, and it was very helpful for helping me at least begin to, and again, the beginnings of an understanding, nowhere near close to comprehensive, but it was a big asset, especially when I was putting together and working with the committee here to put together our survey for our healthcare partners. So thanks to the Bassett Network for doing that, and thank you for continuing to do it, because it's very helpful.
I think it's every 2 to 3 years we have to redo it. So we're looking at the process that we've gone through in the past. Sometimes it's been a lot of just, cut and paste. And we really want to for 2023, take a really deep dive into what the real social determinants are, whether they've changed. The big ones we all kind of know, homelessness, mental health, food, but how, the idea of, just broadband access.
Yeah.
We just did a study trying to figure out how we can do hospital at home. And a lot of that's predicated on having adequate broadband so that you can communicate with the patient at home. So that there's an emergency, you can get the resources, the fire department, whomever, to them, EMS to them, to pick them up within 30 minutes. And so just based on the lack of available broadband and our regional topography, it really limited the space that we could say someone could be safely at home and get back in the face of an emergency. So things like that make rural healthcare more challenging because it's not like you have, thousands of people in a city block that you can say you can take care of.
So to return to something you said, which I think ties into the challenges of rural healthcare, I'm wondering how much of a challenge it is for you in terms of workforce and recruiting employees to this area. I think you have to be, you have to see the unique opportunities that are here and to see the assets that we have. Certainly we have some challenges, but I think those that are motivated by some of those challenges and recognize the assets that we have in this area might be drawn here. Is that a problem for you? And I guess I ask this from the standpoint of having other conversations, and what we keep coming back to is that one of the big challenges is housing. And so while that's not our committee's focus, it is something that the city is working on. I'm beginning to think we maybe need to think about this more broadly than just this committee and how we collaborate with your organization and others. Maybe we need to be thinking more broadly about that. So is that something that you all face as a challenge in terms of recruiting employees to Bassett?
Well, most definitely. Housing is a real big issue, even for those of us who are well compensated. The housing in our area is very expensive. And so for those of us who are frontline workers, our healthcare professionals, it's even more challenging. So we are looking at all sorts of ideas about recruiting, and housing is top on the list. Who do we collaborate with? So we've actually had conversations with SUCO, because the colleges have the same issue with their professors coming to town. Where do they live? And as you know, it was actually a little bit better over the last 2 years, only because the Dreams parks around town were not functioning. And so a lot of people who had seasonal rentals were more apt to give somebody a rental for, a year or 6 months. Now we're already seeing that they're saying no now for the summer because they can get such rates for the summer season because the Dreams parks are opening again. So that's definitely a big issue. Telemedicine has been very helpful. We've been able to use that a lot. But I think there's always unintended consequences. And so as a healthcare organization, we are a major employer within the region. And if we employ people that don't actually bring those dollars back to the region by living within our geography, that actually negatively impacts our rural communities. So we have to think long and hard as to whether or not we're going to go with that fully telemedicine, solution, because the fact is that you don't see people around town, the restaurants don't do well, clothing centers, the malls, all those things. The education systems suffer because they're not bringing people that are going to pay those taxes. So it's a double-edged sword, and so those are the things that people in politics don't often see when they're talking about reimbursement. They just say, okay, we'll just call, tell it whomever, and that person is working out of, Tennessee. I have several people right now who are my assistants and project managers who live outside of the state. Well, they are making very, very good incomes, and in the past they would be here prior to COVID. But then when COVID came, we started letting people say that they could work remotely, and everybody jumped on that and said, okay, I'll live in South Carolina, we'll work remote. I love it, no more winter. But then when it's time to come back, they don't want to come back, and you can't make them come back. That's the new paradigm. lots of different things happening that, it sounds good at the beginning, and then you realize that you just shot yourself in the foot.
I very much appreciate your seeing and bringing to light both sides of that telemedicine paradigm that we have now. I have a couple of quick questions, if that's all right. And I just wonder if you can provide as much, information as you're comfortable with. The time frame for the needs assessment, the health needs assessment, I'm guessing is sometime deep into 2023?
Probably fourth quarter of '22 we'll get started and hopefully produce something in the first and second quarter of '23. I'm not sure the exact time frame, to be honest with you,
Sure.
but I know that we're actually starting to put together preliminary data now and working on how we actually do a deeper dive into what some of the data shows to support our assumptions. In the past, it's been done by different county organizations, and many times they've just kind of cut and pasted data from previous surveys.
So we want that to be obviously a better tool. The mental health facility that you're considering at the hospital, just, if you could expand on that as much as you're comfortable.
This is very preliminary. We've had communications from the senators, Senator Delgado and Schumer and Gillibrand about some support for this, but at this point in time, it's just a matter of having submitted a grant for initial support. And then nobody wants to be first in philanthropic endeavors. Everybody likes to be the last in and say that we've sealed the deal. So we have to get some initial funding, and then we'll be able to figure out where we're going to go. We have the space, but that space needs major renovations, and any type of psych unit would require special coding to make it safe for patients with mental health issues.
In the Tri-Towns of Sydney, the food insecurity, the food pantry essentially that you set up, I was talking to Jeff Joyner, who's talking about that as one of the great successes, and obviously the pandemic's had its effect. But can you talk a little bit more about that and how you think that might be something that might be applicable, to the city's environment?
Well, again, it's having the space. So we had the space at Tri-Town, which made it a very good opportunity for us, hoping that if the pandemic quiets down, we can revisit that. I don't see why we could not do it here in a larger city like Oneonta. This is where the population base is. Obviously, we would need something that would be size appropriate to be effective. The one in Tri-Town in Sydney is significantly smaller than I think that would be necessary for a town like Oneonta. But those are things that we definitely need to explore, and we would be willing to work with you to see what the city's committee wanted to do, and finding space and talking about. I think there's a lot of people that want to be to service their fellow members of the community. So getting donations for that would probably be a no-brainer, but we'd have to have it structured such that it made sense for people to contribute.
Right. And I'm going to sneak one more question in. I had some conversation, once upon a time prior to COVID, there was some consideration of incorporating child care facility into the basement of the, as I understand it, the nursing home behind Fox. Do you know if that's still being considered?
It's raised every once in a while, but it doesn't seem to really gather a great deal of momentum because of the challenges of getting appropriate child care professionals there. But again, that's another one of those things that are important for us with our younger employed frontline staff.
That's it.
Having child care would be a very big plus. But for us, we have a geography the size of the state of Connecticut. So where do you put it? And so it would have to be multiple places. And we're trying to become more systematic in our approaches. So that's one of the things we've been spending a lot of time on the last couple of years, is trying to standardize things across the network. But childcare is an issue that does come up frequently.
Sure. I appreciate that you're looking at a region, as I said, about the size of Connecticut, and we're very city-centric here in terms of, identification of problems and solutions. So forgive the parochial nature of my
That's quite
question.
all right, that's quite all right. We've gone through our own growing pains with that as far as being one Bassett. Over the years, the 5 hospitals in our system have had challenges trying to work as a system. I think that we've made a lot of headway in that regard. So Oneonta is a big part of our catchment area. But as you say, it's not the only area that we have to worry about.
I remember when we had an inpatient psych unit. I think as a hospital, Fox once served this community with many more services than it does now. I saw a gentleman yesterday who was really hoping his wife could get to the nursing home here. He lives here as a community member. And the rate limiting factor there was the staff. So I think that as a network, we talked about recruiting staff and how hard that was, but maybe a commitment to resourcing staff for your facility in turn to serve our community. I guess if anything, I would encourage you to consider is that, project managers get paid a lot, maybe CNAs need to get paid more and have childcare and, I think, again, we've lost a lot in terms of the services that are provided by our local hospital in this community. And I think it's harder to get them back vis-a-vis something for mental health that we once had. But I would just say, again, from an historical perspective, having some responsibility as a network to this community where the population center is, where people may want their loved ones to be cared for closer to home, and not have to have transports out all the time, may be something to consider.
So we definitely give that a lot of thought. And actually, there's always 2 sides to every conversation, if only 2 sides. So when we were going through the pandemic and we were having the working shortages that we had, we made a conscious effort to develop a safe staffing model. But that safe staffing model meant that we had to reduce the number of beds that we kept open. So it was kind of like, self-fulfilling prophecy. There's not enough beds, and now we don't have enough staff, and so we don't have enough staff, so we reduce our beds. And that's been made worse by a recent state mandate for nursing homes in particular, that they have a real staffing model that's, in my opinion, not a realistic model for us to be able to address some of the needs that they have concerns about. Yes, we have concerns about patient safety and quality, but with those staffing models, and we just can't open the beds that we need for the patients who are in our community. So there's a double-edged sword, and we have to find the right model. And we're having a hard time finding that and being sustainable. But challenges. If it was easy, everybody'd have the solutions, right?
That's right, exactly right.
Any other questions for Dr. Knight?
I know I've got 2 pages full of notes here, and a lot